Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the blood supply of the heart. So today I will discuss about the coronary circulation. Coronary circulation. I will discuss about the coronary arteries. Coronary arteries. I will discuss about the cardiac veins. And I will also discuss lymphatic drainage with some applied anatomies, especially I will touch the myocardial infarction, coronary artery bypass grafting, and coronary angioplasty. So we'll go through the blood supply of the heart. The heart is supplied by two arteries. One is the left coronary artery, and another is the right coronary artery. So blood supply of the heart. Blood supply of the heart. We have the left coronary artery, and right coronary artery. The left and right coronary arteries, they arise from the ascending aorta. Both the arteries arises from the ascending aorta. Okay, ascending aorta from the upper part of the aortic semilunar valve, from the sinuses, above the upper part of the aortic semilunar valve. Okay, so you got left coronary artery, right coronary artery. They are branches of the ascending aorta. They begins from the aortic sinuses, which are located above the aortic semilunar valve. Okay, location of the coronary arteries, where they are located. Okay, location of the coronary arteries, of the coronary arteries, where they are located. They are located over the myocardium. Okay, over the myocardium. Myocardium is the muscular tissue in the wall of the heart. Underneath the epicardium, and in the adipose tissue. Okay, so they are over the myocardium. Underneath the epicardium, we have adipose tissue layer between the epicardium and myocardium. The coronary arteries passes in that space over the myocardium. Okay, we got two coronary arteries, right coronary artery, left coronary arteries. We got the location of the coronary arteries. Then we go through the branches of the coronary arteries. Okay. First of all, we go to the right coronary artery, right coronary artery, right coronary artery. The right coronary artery is a branch of the ascending aorta. It arises from the anterior aortic sinus. So, it is a branch of the ascending aorta and it comes out of the anterior aortic sinus. We can call it right aortic sinus. Okay. Then what are the branches of the right coronary artery? We go to the branches of the right coronary artery. Branches of the right coronary artery. Right coronary artery. The right coronary artery has two major branches. One is the right marginal artery. Another one is the posterior interventricular artery. Posterior interventricular artery. Okay, we got two major branches. One is the right marginal artery, another one is the posterior interventricular artery. The right marginal artery passes along the inferior border of the heart. Okay, so the right marginal artery, it passes over the inferior border of the heart. Okay, if you just compare this with the model, this is the heart, this is the inferior border, and we have the right marginal artery. Okay, along the inferior border of the heart. And this is the right coronary artery, arises from the ascending aorta, from the anterior aortic sinus. This is the right coronary artery, the right marginal artery, and it goes posteriorly and gives rise to the posterior interventricular artery. In addition to this artery, right coronary artery also provide nodal artery, that is a branch to the sinoatrial node. Okay, sinoatrial nodal branch. In most cases, the right coronary artery also supplies the AV node. Okay, it also supplies the AV node. So SA node, AV node are usually getting blood supply from the right coronary artery. Okay, we got the branches of the right coronary artery. Now, area of distribution. This is the right coronary artery. It should supply the right atrium, right ventricle. We have some ventricular branches also, other small branches. Okay, then it supplies the posterior interventricular artery, so it supplies the right ventricle, left ventricle. So area of distribution of the right coronary artery. So if you go through that part, area of distribution of the right coronary artery. Okay. Right coronary artery, area of distribution. It supplies the right atrium, right ventricle. It also supplies part of the left ventricle. Okay, so the distribution is here. We got the distribution here. Okay, right atrium getting blood supply from the right coronary artery, right ventricle. Okay, it also supplies the left ventricle from the posterior interventricular branch, right ventricle here. Okay, so these are the area of distribution of the right coronary artery. Okay, then we'll go to the left coronary artery. Okay, so we'll discuss about the left coronary artery. Okay, so the left coronary artery, what are the major branches of the left coronary artery? Left coronary artery branches. What are the branches? We have two major branches. One is the anterior interventricular branch, anterior interventricular artery. This is also called LAD or left anterior descending artery. Okay, or it is always called LAD, left anterior descending artery. Another branch is the circumflex artery. Okay, these are two major branches of the left coronary artery. The left coronary artery, it arises from the left posterior aortic sinus of the ascending aorta. So from where it begins, the left coronary artery, it arises from the ascending aorta. From where? Which part of ascending aorta? From the left posterior aortic sinus. From the left posterior aortic sinus. Left posterior aortic sinus. Okay, you can also call it left aortic sinus. So both the left and right coronary arteries are branches of the ascending aorta. Okay, what are the branches of left coronary artery? We have two major branches. One is the anterior interventricular artery, another one is the circumflex artery. Okay, we got two major branches. Also we have some other branches. The left coronary artery also supplies the left branch of the AV bundle and also part of the Purkinje fibers of the conducting system of the heart. Okay, we got the branches of the left coronary artery. Again, I can write it here, LAD. LAD stands for left anterior descending. We can also call it anterior interventricular artery. We have another branch is the circumflex artery. Okay. from LAD we may get a diagonal branch. Okay, we may get a diagonal branch. Diagonal branch. Okay, it comes out of the LAD, but it is inconstant. It may not be very much visible in many specimens. From circumflex artery, we'll get the left marginal artery. We'll get the left marginal artery. Okay, we got the branches of the left coronary artery. Now, area of distribution. Okay, area of distribution of the left coronary artery. Which part of the heart are supplied to the left coronary artery? We'll go there. So, area of distribution. Okay. So, if we go to this model again, okay, this is the ascending aorta. So, we got the right coronary artery. The origin of the left coronary artery is hidden by the pulmonary trunk, left auricle, but I'm seeing a small part of the left coronary artery. And here it is splitted into anterior interventricular artery and circumflex artery. Circumflex artery give rise to the left marginal artery. So this is left marginal artery, circumflex artery. We may have more than one left marginal artery, that is possible. This is the LAD, anterior interventricular artery. Okay, we got that. So we got the branches of the left coronary artery, right coronary artery. Okay, now we get a term called coronary artery dominance. What is that? Okay, what is coronary artery dominance? Coronary artery dominance. Okay. So usually the posterior interventricular artery is a branch of the right coronary artery. So this is usual. That is called cardiac dominance, coronary artery dominance of the right coronary artery. Okay, so this dominance depends on which artery gives rise to the posterior interventricular artery. So the posterior interventricular artery is the determinant about the coronary artery dominance. It is usually a branch of the right coronary artery. So that is the dominant coronary artery. But in terms of distribution, the left coronary artery has more area of distribution, but right coronary artery, it supplies the SA node, AV node, plus it gives rise to the posterior interventricular artery. So if it gives rise to the posterior interventricular artery, then right coronary artery is the dominant. If the posterior interventricular artery is a branch of, if it is a branch of circumflex artery, and circumflex artery is a branch of the left coronary artery, in that condition we call left coronary artery dominance. So usually right coronary artery dominance, because this is a branch of the right coronary artery. But if this is a branch of the left coronary artery through the circumflex artery, then we call it left coronary artery dominance. Okay, we got the the dominance, and we also discussed the left coronary artery. So if you go there, area of distribution, this is the left coronary artery. It supplies the left ventricle, part of right ventricle. It supplies the auricle, left atrium. Left atrium is getting blood supply from both the left coronary artery and right coronary artery. So this is the left ventricle. It is supplied by the left coronary artery through the circumflex branch. So these are the area of distribution of the left coronary artery. Okay. So we have to know something about the coronary arteries. The coronary arteries are functional end arteries. To remember that. Okay. So coronary arteries. Coronary arteries are functional end arteries. End arteries. Okay. They are functional end arteries. What does it mean? That means there is anastomosis between the left coronary artery and right coronary artery. There is anastomosis between the branches of the left coronary artery and right coronary artery, but that anastomosis is not very much adequate in case of emergency like myocardial infarction. Okay. So when there is a blockage in the artery, the collateral may not be established very quickly. There may be muscular damage, especially the myocardial damage, and that's why, although they have anastomosis, we call it functional end artery. This is not true end artery. They are not true end arteries. They are functional end arteries. They have anastomosis, and anastomosis may develop if there is gradual blockage of the arteries. But in case of emergency, in case of myocardial infarction, that anastomosis is not sufficient to support an adequate collateral circulation. So they are functional end arteries. Okay. So we'll go to the anastomosis between the left and right coronary arteries. Anastomosis. So anastomosis between the left and right coronary arteries. Coronary arteries. Okay. So if you look at the model again, we'll find out that this is the circumflex branch. It may anastomose with the right coronary artery at the crux of the heart. We call the word crux. Okay. So there may be anastomosis between the circumflex artery. This is a branch of left coronary artery. And the right coronary artery. Coronary artery at the crux of the heart. Okay. What is crux? Crux is the area on the posterior aspect of the heart where all four chambers are come in contact together. Okay. So suppose this is the left ventricle, right ventricle. This is the right atrium, left atrium. They are coming close together. Okay. This is the coronary sinus end up here. The circumflex artery may come here. Right coronary artery give rise to the posterior interventricular artery, also called posterior descending artery. So this point is called crux, C-R-U-X, crux of the heart. Okay. So there may be an anastomosis between the circumflex artery and the right coronary artery. Okay. We may have also anastomosis between the LAD or anterior interventricular artery with the posterior interventricular artery. That is also possible. Okay. So there may be an anastomosis between the anterior interventricular artery, anterior interventricular artery, anterior interventricular artery, and posterior interventricular artery along the inferior border of the heart, close to the apex, posterior interventricular artery, ventricular artery. Okay, there might be anastomosis. We must remember that anastomosis vary from heart to heart. Okay, we got that. So there may be anastomosis between the left coronary artery, the right coronary artery over the left atrium. Okay, some branches from the left coronary artery directly goes to the left atrium. Some branches from the right coronary artery goes to the left atrium. So there may be communication between the left coronary artery and the right coronary artery. So we got the left coronary artery, we got the right coronary artery. Now we'll go to the veins of the heart. Veins of the heart wall also need the venous drainage. So venous drainage of the heart, venous drainage of the heart. Okay, of the heart. Venous drainage of the heart. So the vein in the wall of the heart is the coronary sinus, most important vein. Okay, that is the coronary sinus. Coronary sinus is present in the coronary groove or coronary sulcus. Coronary sulcus is the junction between the atria and the ventricle. Our coronary arteries, what we discussed previously, they also passes along the coronary sulcus or coronary groove in most of the part of their distribution. Okay, coronary sinus is located on the posterior aspect of the heart between the left atrium and the left ventricle. Okay, located in the coronary sulcus or groove, coronary sulcus, you can call also groove, coronary groove. Okay, between the left atrium and left ventricle on the posterior aspect of the heart. Okay. So this is around 3 centimeter in length. 3 centimeter in length. Okay. It is located posteriorly. So we have to identify that. Okay. So this is the coronary sinus. This is the vein. This is present in the groove between the atria and ventricle called the coronary sulcus or coronary groove. This is the coronary sinus. This is the vein. This is the major vein on the wall of the heart. So what are the tributaries of coronary sinus? Okay. Before going to there, we have to know that this is around 3 centimeter in length. Where it opens into the right atrium, located between the left atrium, left ventricle, but it opens into the right atrium. Okay, so we'll go through the tributaries of the coronary sinus. What are the tributaries of the coronary sinus? Okay. Tributaries. Tributaries. What are the tributaries? We have the great cardiac vein, we have the oblique vein of left atrium, oblique vein of left atrium, also called oblique vein of Marshall, okay, also called oblique vein of Marshall, okay. We have the middle cardiac vein, middle cardiac vein, we have the small cardiac vein, then we have posterior left ventricular vein, posterior left ventricular vein, okay, we got that. So sometimes the right marginal vein may be an independent vein, right marginal vein, okay. So we got the tributaries of the coronary sinus, okay. So we got that great cardiac vein, oblique vein of left atrium, middle cardiac vein, small cardiac vein, posterior vein or veins of the left ventricle, posterior left ventricular vein or veins may have multiple, and right marginal vein may be a tributary of small cardiac vein, or small cardiac vein may be separate, right marginal vein may be tributary of the coronary sinus, okay. We have this, we have also some other vein like that of anterior cardiac veins. We have also vena cordis minimi, also called smallest cardiac veins, okay. These anterior cardiac veins or vena cordis minimi, that is also called smallest cardiac vein, they may open directly into the heart chamber, especially anterior cardiac vein opens into the right atrium. We may have 2, 3, maybe 4. Vena cordis minimi are multiple, very small vein. They communicate the myocardium to the lumen of the heart cavity, so they have no valve. So these veins, they are valveless and they are very small. So blood may go from the chambers of the heart to the myocardium, or from the myocardium to the chamber of the heart. Both way it is possible because there is no valve in very small cardiac veins. So we got the veins of the heart. Okay, very good. Now we'll discuss something about the lymphatic drainage of the heart. Okay. Lymphatic drainage of the heart. Okay. The lymphatic drainage of the heart, the the lymphatics will follow the blood vessels and they will go to the tracheobronchial lymph nodes, tracheobronchial lymph nodes. They may also go to the brachiocephalic lymph node, brachiocephalic lymph nodes. Okay, so they follow the blood vessels. We got that. Now we'll find out some accompaniment of the arteries and veins. Okay, accompaniments of the arteries and veins. So, accompanying arteries and veins, arteries and veins. Okay, so if we look at the model again, we'll find out that. Okay, so look at that. This is the anterior interventricular groove. It has we are looking here. This is the LAD, that is a branch of the left coronary artery. Here is the great cardiac vein. Great cardiac vein is a tributary of the coronary sinus. Okay, we might have one small vein here. It is not shown in this model. That is the oblique vein of left atrium. It may be very small, maybe very much attenuated. Okay, that represent the left superior vena cava embryologically, that is derived from the sinus venosus. Okay, so in the anterior interventricular group we have the LAD and the great cardiac vein. In the posterior interventricular group we have the middle cardiac vein. This is a tributary of the coronary sinus, and one artery, this is the posterior interventricular artery. There is a branch of the right coronary artery. We have the small cardiac vein may come out from this part, may be small, and our right marginal vein may open directly into the right atrium. Right marginal vein may continue it as the small cardiac vein. We have multiple anterior cardiac vein. They opens directly into the right atrium. Okay, we got the vein. Now I like to discuss some of the applied anatomy. Okay, applied anatomy. Okay, coronary artery disease is the leading cause of death. So, CAD is the leading cause of death all over the world. Okay, death. So we must know that this artery may undergo atherosclerosis. So there may be chance of atherosclerosis. Okay, fat deposition, fibrous tissue deposition in the wall of the coronary arteries. So the lumen of the artery may be compromised. So there may be atherosclerotic blockades. So lumen is compromised. The coronary artery lumen is compromised. Coronary artery lumen is blocked by atherosclerosis. Okay, fat deposition here. That may lead to two conditions. One is angina pectoris. Okay, this is the heart. Here is the heart. This is the artery. Okay, if it is blocked, partially blocked, we may get angina pectoris. That blood flow to the myocardium is not sufficient. There will be hypoxia in the myocardium plus lactic acid formation there. That may lead to ischemic pain, angina pectoris. It may be severely blocked. totally blocked, that will lead to necrosis of this tissue, necrosis or nuclear death of cell of the cardiac muscles. We call it myocardial infarction. Here pain is severe and pain does not disappear on rest. Angina pectoris pain is present, but taking rest after 15 seconds to 15 minutes, it will disappear, person taking rest. Here pain is more severe, even after 15 minutes later, pain is continued to aggravate. This is the myocardial infarction. Okay. So two conditions, angina pectoris, myocardial infarction. Okay. What happens? So surgeon do two type of, the cardiologist and cardiac surgeon, they manage this case. One is percutaneous transluminal coronary angioplasty. What is the procedure? A catheter is passed to the blocked artery. Catheter is passed to the blocked artery, and there is a balloon there. It is inflated. Balloon is inflated. There is a balloon is inflated and it is broken. The block is broken because the balloon will go there. Catheter, then it will be ballooned out. So it will be open now. Catheter guided angioplasty, ballooning out, and they put a stent. That is possible. That they may inject some type of medication there, thrombokinase. There may be some type of device to take out the clot. Okay, so that is one way. That is PTCA. We call it PTCA. That is done by catheter. PTCA, percutaneous transluminal coronary angioplasty. Another important point is that if that is not feasible, then we do, the surgeon do coronary artery bypass grafting. That is called coronary artery bypass grafting. What is that? So suppose in my heart there is some blockage here. Okay, it is not feasible for catheter guided removal. What will happen? So we need a bypass channel. So this is the arch of the aorta. Suppose arch of the aorta is here, arch of the aorta. So this, some artery should communicate from here to here so that blood will go from the aorta to this part. So any other artery may be connected. So what is this bypass artery or vein? What is this bypass structure? Usually we use the cardiac surgeon use the internal thoracic artery. Internal thoracic artery for bypass grafting. This may be a part of internal thoracic artery, or it may be a part of great saphenous vein. Great saphenous vein. Okay. Or it may be a part of the radial artery. Okay. These are commonly used in case of coronary artery bypass grafting. Okay. So which part of the heart is most commonly blocked in myocardial infarction? Okay. blockage of the coronary arteries in myocardial infarction. Blockage of the coronary arteries in MI or myocardial infarction. Most commonly it is the LAD. Second most common is the right coronary artery. Right coronary artery. Or it may be the circumflex artery, or any of the branches of the left and right coronary arteries, or other branches of left and right coronary artery. Left and right coronary arteries. Okay, we got the arteries commonly blocked in case of myocardial infarction. Most commonly LAD, anterior intraventricular artery, right coronary artery, circumflex artery, branches of left and right coronary arteries. So we may have more than 3 or 5 blocked. Okay, we got the myocardial infarction, angina pectoris, PTCA, CABG. Okay, we got the commonly blocked arteries. Okay, so that's all for today. If you have any question, please feel free to ask me. This is a very important chapter, coronary arteries.